My name is Gabby Price. I'm a professional tennis player living and training in Boca Raton, Florida. I started playing tennis when I was 3 years old. My dad started me for the first time in Puerto Rico, and ever since then we were training every single day, and we started going back and forth to Florida actually to train with Rick Macy. And when I was 10 years old, we finally moved to Florida. My coach is Johan Creek, and I've only been with him for 2 months now, but he was a Grand Slam champion.
I love watching my daughter on the tennis court. She has come so far in their short years.
I qualified for Wimbledon when I was 14 years old, and you have to be top 40 in the world to be able to play, and that was very tough being so young, and that was definitely one of my proudest experiences in my tennis career so far. Tennis is a very physically demanding sport on the body, especially when you've been playing for 16 years. So you're definitely prone to some injuries, and last year I tore my ankle for the 3rd time in a tournament in France. And at Wimbledon, actually, I broke my finger. I've had some wrist injuries and some chronic elbow tendonitis.
What attracted me to Maragal Medical was I'm really close with Timmy Gallagher, Dr. Gallagher. We were good friends in chiropractic school, and Tim and I keep in touch quite a bit. He's an avid tennis fan, so his kids play, and so do mine, so we compare stories.
I always kept in touch with Mark, and in the early days I would see, footage of his daughter Gabby and noted on what an amazing tennis player she was. So I followed her through Mark. But Gabby's career just completely took off. And it was fun to watch, knowing that one of my good friends' daughter had reached that high level of play.
He's followed Gabriella along the way since she's been a pro tennis player. And when I mentioned to Timmy that she's had some injuries, he said to come and investigate stem cells and what he can perform and how he can help Gabriella.
One of the things that Dr. Marciello and I try to do is, when we have an athlete or any patient traveling from a great distance, we just try to get as much information as possible. We had a plan of attack when Gabby came up. It's a basic plan of attack on, what we're gonna do. First and foremost, now we got to get her face-to-face with Dr. Marciello, and he was able to spend the time, get an understanding of, what the MRI showed and actually where the focus of injury needed to be.
When we think about what brought them in, really is not necessarily their diagnosis. The observation and the aspects of trying to hear the story and listening to Gabby complaining about some knee pain, some overuse strain of her injury of her elbow and shoulder, really is just the starting point. The idea of actually then being diagnostically looking at the medical history along with medical diagnostic studies, MRI pictures, x-rays, is then the next step in trying to figure out what her problem may be. And then it's an aspects of physical exam. She can tell me she hurts, but really getting into the nitty-gritty about what moves correctly, what hurts in certain positions, and some of our diagnostic examination techniques is really how we really come up with the best understanding of her treatments and the injuries that she has sustained.
You can have all of these technologies available to you, but if you don't have an accurate diagnosis, and if you don't know what the problem is, you're not going to have a successful outcome. So having that eval is key. We use this cutting-edge robotics technology, and this was really the first time that we could actually use it on a professional athlete. So there's a lot of different indexes that we use the robotics for patients. So for example, it has a silver index. We use that for the elderly population to help with fall risk. It has a knee index that we use for patients. One of the more common complaints is knee osteoarthritis. So it gives us some good understanding on what the limitations are with the knee and how to treat it. The performance index, that's the high-end index. That's something that we've toyed around with, but we just haven't had access to a professional athlete for. So we were really excited to get Gabby on the Honova robotics and use the performance index to really tease out, some of the smaller things that, maybe, we could expand on her recovery after the injection.
I'm a chiropractor, so I see and hear all the latest techniques and technology out there that can help my patients. Since I'm an athlete, I've treated patients and that have had injuries, and regenerative medicine is up and coming, and I believe that these techniques can really help an athlete further their ability to the top, no matter what injury they have.
I decided to go with this treatment option because I've tried everything else and nothing seemed to work, so this is kind of my last option. because I don't need surgery or anything like that. Tim's one of the best, and I heard the doctor who's doing my treatment is supposed to be very good. I've tried many treatment options for my injuries, such as stim, acupuncture, massage, red light therapy, physical therapy. Nothing has helped before, so I'm hoping these injections help with my recovery.
So Gabby will be receiving a Wharton's Jelly allograft by Regenerative Labs, and we're hoping that this helps get her through some of her injuries that she's been hampered with for the last couple of years.
We're so fortunate to be part of Regenerative Labs. They were the ones that sponsored Gabby's injections.
Regenerative Laboratory really was a lab that we started to use because we recognized that the Wharton's Jelly product was actually by far showing more effectiveness to our patients. Regenerative medicine is really a way in which we can utilize products, utilize the body's own capabilities to repair damaged tissue. So in a simplistic way, we think about regenerative medicine as enhancing the healing properties of our own body's capabilities. So regenerative medicine really is a way that our body repairs our own damaged tissues.
So depending on how the injections and the regenerative medicine works this time, I don't see this as being a one-shot deal. I feel that this will be a long-term commitment to us, and as long as Dr. Gallagher is willing to help Gabriella, you know, she has a long career ahead of her. So if we can get something natural, such as regenerative medicine, we're willing to come back here as much as possible.
If you think about the rigors of the professional women's tennis tour, there may be occasions where, you know, she re-injures or she needs to come back for like a booster. Dr. Marciello and I have even looked at, you know, using regenerative medicine as a preventative measure. If you think about, you know, whether your son or daughter is as an athlete in high school or junior high school, or for an AAU team, or if they make the collegiate level, or if they really go to the next level at the professional level, these are abnormal mechanics that you don't put your body through on a regular basis. So, of course, all the training and the physical therapy and the prep that goes into it will help with injury prevention. But if you're constantly stressing that area, there's going to be a time where tissue's just going to break down. And if you can use a completely safe regenerative injection to help repair all of those micro traumas so that it doesn't turn into a bigger macro trauma, well, that's the way to go.
I'm most looking forward to, after the injections, getting back pain-free on the court and getting back to a full tournament schedule.
I look forward to seeing her progress going forward. Just to watch her play, compete, grind, understand the ups and downs of being a pro tennis player has made me so proud of her. She's been through the agony, the ecstasy, and seeing her playing junior Wimbledon, junior French Open, junior US Open numerous times has made me the proudest guy ever.
My goal in tennis is to be #1 in the world and win Wimbledon and the US Open.
We're very optimistic that she's gonna do great with the treatment, and her career is just gonna take off. I always like to say too, you don't have to be a professional athlete to benefit from care. The everyday patient, you know, whether it's, you know, difficulty hitting a forehand to make the US Open, or if you're having challenges going up and down the stairs, if you're out of work because of some disability, or if you're having difficulty getting on the floor to play with your grandchildren due to pain, we can help you. Our approach is completely unique. We really emphasize getting to the root cause of the patient's problem. We take our time, and we have this multifaceted approach where medical, physical therapy, and chiropractic care all work together to make sure each and every patient gets the best care possible. You throw regenerative medicine into the mix, that's a game changer.